Hi everyone, welcome back to my channel. This is Dr. Farida Rajan Ibrahim Omasundi. So in this video today we are going to discuss arthritis. We are going to look at the different types, the risk factors, the symptoms, the diagnosis, as well as the management. If you are new or you haven't liked this channel, please do like, share and subscribe. Arthritis refers to inflammation of one or more joints leading to pain, swelling, stiffness, and decreased movement. There are various types of arthritis, but in this video, we'll mainly focus on two, which are osteoarthritis as well as rheumatoid arthritis. So coming to osteoarthritis, this is the most common type. It is caused by wear and tear of joint cartilage over time. It is common in older adults, especially women and those with joint injuries or obesity. It commonly affects knees, hips, hands, and spine. And for rheumatoid arthritis, this is an autoimmune disease where the immune system attacks the joint lining or the synovium. This leads to chronic inflammation, deformity, as well as loss of joint function. It is most common in middle-aged women. So what are the causes and risk factors? The various causes and risk factors include things such as age. The risk increases with age. Gender, mostly women are more prone, especially to rheumatoid arthritis. Genetics, mostly it runs in families, so a family history increases the risk. Obesity, mainly extra weight, adds stress to the joints. Injury, so for joint damage, it can trigger arthritis later in life. Infections, so there are certain infections that can inflame the joints, leading to arthritis. Autoimmune factors, especially in rheumatoid arthritis and lupus-related arthritis as well, are some of the risk factors. So coming to the pathophysiology, this is what happens. The cartilage will wear away and the bones will start rubbing against each other, which will lead to pain, swelling, and stiffness. The bone spurs may form, worsening the pain. That is mostly in osteoarthritis. But in rheumatoid arthritis, the immune system attacks the synovial membrane, causing inflammation, joint lining thickens, and it will lead to damage to the cartilage and bone, which will adversely lead to deformity. So what are the signs and symptoms? Mainly we have joint pain and tenderness. The patient will come in complaining of swelling around joints, stiffness, especially in the morning or after rest, reduced range of motion, warmth and redness over affected areas, fatigue, especially in autoimmune types, and in chronic cases we can have joint deformity and disability. So what's the diagnosis? So the diagnostic strategies: first and foremost, you have to get a detailed history and physical examination. And then you have to carry out blood tests as well. So you can, apart from your full blood counts, you can do your markers of inflammation, your ESR, CRP. You can also do the rheumatoid factor. You can do your specific tests for rheumatoid arthritis, such as the anti-CCP antibodies. You can also do your x-rays, your MRI, your CT scans, or your ultrasounds to assess joint damage or inflammation. For treatment options, you can divide into the non-pharmacological as well as pharmacological. So the non-pharmacological treatment, this is where you just encourage rest and exercise, weight loss if obese, physical therapy to improve movement. You can also give medications such as analgesics, where you give your paracetamol or tramadol for pain relief. You can give your non-steroidal anti-inflammatory drugs such as ibuprofen, diclofenac to reduce pain and inflammation. You can give your corticosteroids such as prednisolone for severe inflammation. You can also give your disease-modifying anti-rheumatic drugs such as the methotrexate. there are also surgical options that you can carry out. So what are the complications? So complications will include things such as joint deformity and disability, loss of mobility, chronic pain, depression and anxiety due to long-term pain, heart problems, especially in rheumatoid arthritis, and you can also have things such as kidney damage from long-term medications. How do you prevent it? So mainly you have to maintain a healthy weight, you have to exercise regularly, you have to avoid joint injuries, eat a balanced diet, control blood sugar and uric acid levels, avoid smoking and excessive alcohol, and treat infections early. So you have to treat any joint pains that persist. So that was just a brief discussion on arthritis. See you in the next video. Thank you.